and Valley counties. You see it's right there in the center of the state. It has a 7-member health board that's appointed by local county commissioners. And this summer, as Idaho steamed toward this unprecedented collapse of their hospital system, with literally active duty federal troops having to come in to staff beds, with hospital care officially being rationed because they are swamped with COVID patients, this summer, in June, officials in the state's largest health district fired a 15-year veteran of that health board, a nationally recognized physician who had given mainstream COVID advice in line with federal guidelines. They fired him. The person Idaho picked to replace him, to join the biggest health board in the state in the middle of this crisis, is this guy, who is a pathologist who runs a local medical lab. He says that we should call the CDC the Ministry of Truth because they're just like the propaganda arm of the fictional totalitarian regime in the novel 1984. He says COVID vaccines must be, quote, stopped. He calls vaccines a, quote, poisonous attack on our population that needs to stop now. He has also advocated for the use of the horse deworming medication ivermectin, which the CDC, the FDA, and the drug zone manufacturers have pleaded with the public to stop using to treat or prevent COVID, since it neither treats nor prevents COVID, but it's very easy to OD on it and make yourself very ill. This is how the local NPR station in Boise headlined their article about this doctor's appointment to the Central Health District. Quote, doctor up for Idaho Health Board spot calls COVID-19 vaccine needle rape. Because he did, in fact, call it that. He was officially approved to the Idaho Central Health District Health Board this week. Chosen, he had competition. There was also an epidemiologist who was up for the spot and an infectious disease specialist who was up for the spot, but they went with the guy who calls vaccines needle rape instead. As the state of Idaho approaches statewide crisis standards of care in hospital rationing because of the crush of COVID patients they are contending with, there appears to be a mismatch in terms of the crisis that Idaho is facing and what its leadership on the ground is doing.